Hi, you guys, and welcome to the channel. My name is London. I am a labor and delivery nurse and have been for many years. I have assisted in over 100 deliveries and have helped women from lower economic status to higher economic status, women who have done C-sections, high birth deliveries, women who have gone unmedicated. So I have a realm of knowledge when it comes to labor and delivery, and also the postpartum phase and also the antepartum phase. And I am here to help you guys make informed decisions, and that is what this channel is for. It is to help educate you guys so that you feel empowered and inspired to make your own decisions when it comes to your healthcare, or partner with your healthcare professionals so that you guys can come up with a plan of care for you that best fits you. I am in no way giving any advice on this channel. I want you to really take the information, learn from the information, but really come up with a plan of care with your particular healthcare professional. So please understand that this channel is not giving any advice to anyone. It is simply my knowledge, what I have gained, and I am sharing that with you to hopefully educate you in some way so that you can make better decisions for yourself. So without further ado, today we are going to be talking about what are some indications for an induction. And indications just basically means what are some reasons people would be induced, right? What are some reasons that your healthcare provider may say, we need to schedule an induction for you because of XYZ. Typically, an induction is scheduled at about 39 weeks, but sometimes inductions are scheduled earlier depending on what is going on with you and also your baby. So reasons inductions, maybe your healthcare provider may say that you need an induction. Number one, and this is the most common one that I see, is preeclampsia. Preeclampsia is a condition that is associated with blood pressure, and the risk is eclampsia. So that is one of the reasons, which is basically seizures in pregnancy. So that is one of the reasons why your healthcare provider may say you need to be induced. The other reason is something that I see that is also common, which is IUGR. That is how they word it. It is intrauterine growth restriction. And that is when the baby's not growing to the size based on percentiles that your healthcare provider may feel that the baby should be growing at. And so they may recommend an induction. The next thing that I see is something called polyhydramnios and olihydramnios. Polyhydramnios means that there is too much amniotic fluid, and olihydramnios means that there is too little amniotic fluid. So healthcare providers may recommend inductions for those two reasons as well. The last two things that I really see when it comes to scheduled inductions is something called cholestasis. This is a condition where you may be very itchy, and it can get worse and worse throughout pregnancy. And then the last thing, which this really isn't the last things, there's multiple other things. These are just the most common reasons. But the last most common one that I see is something called gestational diabetes. This is, and you can either be diet controlled or you can be on insulin. If you have gestational diabetes, some healthcare providers will recommend scheduling an induction just so that the baby doesn't get too big. And there are several different reasons for that. I almost forgot one more, but the actual last one is also for postdates. That's when you have gone over 41 weeks of gestation and nothing's really happening. Your body's not really going into labor. And so your healthcare provider may recommend an induction in that case as well. If you guys want me to break down all of these different things and go further into detail as to what all of these different conditions mean and why an induction would be recommended, just let me know down in the comments below, and I can go through each one and create a video about that. But just so that this video isn't too long, we're just going to name them. And if you want more detail as to what each condition means, how it affects the baby, how it can affect you, I can go into that. Just leave it down in the comments below so that I know you guys want to see a video about that. So back to the induction process. So when you go into the hospital for an induction, the first thing that we usually do is you usually skip the triage area unless for any reason you come in on a date that you're not scheduled to be induced. But if you have an appointment and a time to be induced, you usually go right into a room unless there is no rooms available. Your nurse will do all of your triage stuff inside of your room. You will get an IV, which is a line that's into your vein. This line is very important. It is the only really way we can help you or the baby. In the event that you need something, we can use that line. In the event that the baby needs something, we can also use that line. And what the baby will mostly need from that line would most likely be fluid. So an IV is usually placed at most hospitals, all hospitals that I've ever been at. An IV has been required for an induction because giving you fluid is one of the resuscitative measures that we do to help the baby in the event that the baby needs some help along the way during labor. The next thing that happens is you'll get a series of questions when you go in. Your nurse will ask you a series of questions. Your partner can be there. Usually they set you up and they talk about what medications you are going to be offered or how the induction process is going to work. And it's usually like, I would say 1 to 2 hours of not much happening, just them admitting you into the hospital. So once you are admitted, usually your healthcare provider will come in and they will talk about the various different medications that we give for an induction, and you also may get a cervical exam. So let's start with the medications that are offered for an induction. So until next time, I will see you guys in my next video. And yeah, love you, wishing you the best, the most safe, and the most wonderful delivery. Understand that this is a journey and just enjoy the journey. Bye.